UHBF is local for Bettendorf and local for you. This is Local 4 News at 5.
Welcome back. Healthcare when we approach the end of our lives can involve making some difficult decisions. Dr. Bruce Chamberlain is the medical director of Genesis Palliative Care, and he's here to talk about those important choices. Thanks so much for joining us, Doctor.
I appreciate the invitation, Jim.
Your specialty is palliative care. How is that different, or is it part of overall hospice care?
Palliative care encompasses hospice care. Best way I can describe it is that you can have hospice, and hospice is part of palliative care, but not all palliative care is part of hospice. So palliative care, we move upstream from end of life to helping to manage symptoms and improve quality of life with people who have serious or advanced illness, but aren't necessarily dying.
You're really working with those patients longer, obviously.
Exactly.
Hospice is really those ends, the end of the life, last few days perhaps. How are decisions made about the appropriate time for hospice and palliative care?
Well, you know, actually one of the things you just said is part of the thing that we struggle against, and you mentioned last few days, and really people have that image that hospice means I'm at the very end of my life. In fact, hospice, as kind of defined by the Medicare hospice benefit, is designed for the last 6 months of life. So people who have advanced or serious illness, who are disabled by that illness, and who are showing progressive disease impairment, they can call a hospice and have a free evaluation. It doesn't cost anything. You don't need a doctor's order. And they will come out and evaluate and tell you, are you eligible for hospice? Or if not, what will it take, you know, what signs or symptoms need to be found to indicate that now you are eligible for hospice.
In some cases, you can have what's called home hospice care too.
In most cases.
Who is part of a care team at the end of life?
Generally, well, a physician. There's a medical director for the hospice. There's a nurse case manager that goes into the home and visits the patient. There is a social worker, usually a chaplain and a bereavement coordinator, and then home health care aides that come in to assist the patient and family.
Is the patient's primary care doctor still part of that team?
They can be. And that's actually one of the things we try to encourage, is to maintain that continuity of care so that the primary care physician can be involved with that patient right up until the end.
And we mentioned that home hospice care is certainly a part of this whole treatment. We're going to move on here. Dr. Chamberlain, thanks so much for your time. Appreciate all that you're doing, and I'm sure a lot of your services are very valuable to the people in this community. Thanks for your time. Well, straight ahead,